Welcome to another episode of Dr. D's Table Talk. We are very lucky to have two distinguished gentlemen today who are experts in their pediatric infectious disease field. And we'll be talking about the topic, which is very commonly being discussed right now on COVID vaccination in children from 5 to 11 years of age. And we will certainly talk about other aspects of COVID vaccination and other questions that parents usually have for their children. So let me introduce my guest today. Our first guest is Dr. Tekippe, who is Medical Director of Pediatric Infectious Disease Program at Advocate Aurora Healthcare at Children's Hospital in Oakland and Park Ridge. He is MD, PhD, and he did his PhD in molecular genetics and molecular biology from Duke University. He did his pediatric infectious disease residency at St. Louis Children's Hospital in Washington, St. Louis Children's Hospital in Washington University at St. Louis. And subsequently, he joined his Advocate Children's Hospital. He completed his fellowship in pediatric infectious disease at University of Southwestern Texas in Dallas. Welcome, Dr. Mickey.
Thank you. I'm glad to be here.
We are joined by our guest, Dr. Surasak Pratuangtham, who is a pediatric infectious disease specialist. He's board certified in pediatric infectious disease and pediatrics. And he was working at pediatric infectious disease specialist at Advocate Children's Hospital. And now he's a pediatrician at Southwest Pediatrics in Palos Park and Mokina. Welcome, Dr. Surasak.
Thank you, Dr. S. Good to talk to you again this time.
Thank you very much. So let's jump into the topic right now. And let me start with Dr. Surasak. What are the current COVID vaccinations available for children in the country?
Okay, I will give you the most updated authorization about the vaccines that we have. Of course, in the US, we have 3 vaccines authorized by FDA. Some of them are full approval already, and some of them are still under the EUA. Currently, we have 2 mRNA vaccines. One is a Pfizer vaccine, which is now, they changed the name. They call Comirnaty. Yeah, that is the current name of the Pfizer vaccine. And the other one is a Moderna vaccine, which is also an mRNA vaccine. And this one, they have a name they call Spikevax. Yeah. So when you hear Spikevax, it is a Moderna vaccine. And the last one is a Johnson & Johnson vaccine. That one is the vector vaccine. So just in short, the only one that is now get a full approval from FDA is a Pfizer vaccine or Comirnaty, if you want to keep the username. And that one is authorized for people 16 and older, coming in 2 doses.
Okay.
The other one that is currently in the EUA, one is the Moderna vaccine for 18 and older, and also Johnson & Johnson, which is 18 and older as well. The FDA also recently, of course, as we all know, probably, they approved the Pfizer vaccine for booster as a 3rd dose for the adult 65 and older, and also for people older than 18 with certain underlying conditions. Okay. As well as the frontline worker like doctors and teachers, yeah, because of the high risk of exposure. So for the Moderna vaccine and Johnson & Johnson is still under the EUA.
Okay.
So, I almost forgot. And as we know, we now have the Pfizer vaccine authorized under the EUA, which is an emergency use for children 15 years and older. I'm sorry, 12 years and older.
Okay.
And it is very exciting that now we're gonna get to use the vaccine for children 5 years to 11 years, which I probably prefer Dr. Mickey to talk about.
Coming back to Dr. Mickey, if you could unpack this for us in terms of EUA for 5 to 11 years old, which is a very exciting news for parents, children, and pediatricians, and who are all involved with taking care of kids. So if you could tell us the exact process as to what has happened so far, the dose, the side effects, and how many dosages are needed, and if you could unpack that information for us, we'd appreciate it.
No problem. So I'm going to speak as of where things are today on Halloween 2021. So the FDA has approved an emergency use authorization for the Pfizer vaccine for children 5 to 11. It currently has not yet been evaluated by the CDC, but the plan is for that to happen sometime this week. Once the CDC evaluates it, and likely at this point in time makes a recommendation to approve that vaccination for that age range, vaccines will start to become available. This vaccine is 1/3 of the dose of the Pfizer vaccine that's given to the adults. So it's a smaller dose. Like the adult dose, it's given twice, separated by 3 to 4 weeks ideally.
Okay. And what is the next step now? What are the other requirements before this vaccine can be given into pediatric kids' arms from 5 to 11 at various places, including pediatrician offices and hospitals?
The biggest step at this point in time will be CDC approval. So the CDC is looking to make a recommendation. They have a meeting scheduled for this Wednesday, November 3rd, and will likely hear something either from that meeting or shortly thereafter. At this point in time, the kind of preliminary evidence from the FDA suggests the CDC will likely approve the vaccine at that point in time, but we're still waiting on those final results.
Sure. What are the studies that have shown so far we submitted to FDA in terms of side effects in pediatric population from 5 to 11? And that's the concern from a lot of parents.
Great question. And that is, we do see a lot of public polling and in talking to other parents myself, that does suggest that there are safety concerns that people have. So far, the study, the Pfizer study that was submitted to the FDA is a little bit of a smaller study than what was originally done with the adults. But they've looked to take a lot of the adult data as well to kind of booster their safety response. So far, kind of the biggest side effects, or I should take that back, the most common side effects that we have seen are muscle soreness, fatigue, headaches, and occasionally fever. This does not happen with every patient, but it has happened with a number of patients, both on the adult side and in the pediatric population. That's why oftentimes you'll hear doctors will often recommend scheduling some time the next day where you don't have too much of a heavy activity, because people often don't feel very well that day. Those effects, though, are pretty short-lived. They generally seem to go away within 24 hours or so after the vaccination, 48 hours, typically on the long end. So those are the most common side effects. They're not particularly severe, but feeling uncomfortable for a day is not unusual. The more kind of concerning side effect and what we're looking to keep an eye out for is a condition called myocarditis. So myocarditis is inflammation of the heart muscle, and it can cause the heart not to function as well. Now, we don't know how common this is exactly, and we don't really know how common it's going to be in the pediatric population, given the size of the study. Based on what we know from treating kids 12 to 18 plus young adults, it generally seems that this condition of myocarditis might happen as frequently as 1 in 100,000 in boys and young men. The rate seems to be much lower for whatever reason in girls and young women, but it has happened, we think, about 1 in 100,000 cases of young men.
Sure. And I'm sure you're seeing a lot of kids getting admitted with COVID and its complications. So in terms of your numbers that you just mentioned, it's still probably important to get the COVID vaccination rather than getting the COVID disease or the illness. Is that a correct statement?
That's a very true statement. So while there is a risk of myocarditis with the vaccination, that risk, as I said, may be as high as 1 in 100,000. The risk with COVID itself is much higher, probably close to 1 in 3,000, we think. I've seen at this point in time about 45 kids with what we call multi-system inflammatory syndrome in children, or MISC. So these are kids that often come in with heart dysfunction, including myocarditis, and are severely ill. And we think that that happens maybe as frequently as 1 to 3,000 kids. And it's particularly important for this age range that we're looking at vaccination with 5 to 11, as the range that happens most frequently to get MIS-C are really in this 8 to 14 age range, which overlaps obviously with the 5 to 11 age range that's now going to be vaccinated.
Sure. Dr. Surasak, what have you seen now so far in your outpatient clinic in the last couple of months when you have vaccinated 12 years and above children? What are they coming back with? What kind of common side effects you have noticed? And are there any serious effects that you have noticed in your practice?
Zero. And however, remember, we immunized probably the children 12 years and older only in a fraction of the number of patients that you can see the side effect in terms of myocarditis. Like what Dr. Mickey said, 1 in 100,000, that's what you're going to see the side effect.
Sure.
In our population, we immunize probably like hundreds or maybe close to 1,000 children. So far, we don't see that.
Oh.
However, remember one thing from the data that they compile for the children, young children that get the myocarditis, most of them have mild myocarditis and they recover completely.
Sure.
So therefore, I feel very confident that this vaccine should be quite similar to the one that we're going to give to children 5 years to 11 years old, should have similar side effect profile, just like the one that we give to 12 years and older.
Sure. Dr. Mickey, what do you think there will be impact on school attendance and school going forward in wintertime, because we'll be facing risk from other viruses as well? So what kind of impact do you expect when we give this vaccine from 5-year to 11-year-olds in terms of school attendance and school concerns that you look forward to?
So the hope with this is that fewer kids will miss days of school because there will be less COVID infection.
Sure.
One other thing that may be noted is in Cook County, most of the schools recommend, if you travel out of state to most states, that you come back and quarantine if you're not vaccinated.
Sure.
If these children get vaccinated, that may help reduce that quarantine time and let kids get back to school faster.
Sure, sure. Dr. Surasak, what kind of impact do you think it will have on children who are not getting the vaccine, such as the 5-year-olds and below? What should I expect for children, infants, toddlers, and preschool kids on this vaccine, in terms of they are not going to get the vaccine for at least a few months till further studies are done? So your comments about how to protect children below age 5.
Good question. I don't think anybody has any good answer. As we all know, when we have the lockdown, the school closed, daycare closed, a lot of hardship on parents and
Sure.
students. As you may see, Dr. Deshpande, we have a lot of children who have a psychological problem, right? Because they miss the school. So since the school opened, as we expected, a lot of children now are getting COVID. Although majority of them have mild cases, of course we see some cases that can be a little bit more moderate, not to the point that it was severe. But as Dr. Mickey said, we never know about a long-term complication like the MIS-C that we may see in some children, and of course they can also have myocarditis,
Sure.
just from the coronavirus itself.
Sure.
So all in all, I think this virus is gonna get to everybody. Everybody is gonna get this virus. In the fact that when you get the virus, you're gonna be very sick, or you're gonna be not so sick, or you can avoid it if you have immunity. Yeah, just like when you are vaccinated. I personally have followed a number of young adults and also children 12 years and older who are vaccinated, fully vaccinated with the Pfizer vaccine. Despite them having a close contact, for example, like family members, that we know that the transmission is very high. None of these fully vaccinated young people are infected. we did PCR in many of them, and all of them came back negative.
Sure. So that's a very encouraging news for vaccines, and that should also reduce the parental hesitancy in vaccinating their children. Dr. Mickey, given your molecular biology and background, what do you think is the impact of this particular vaccine, COVID vaccine 5 to 11 and 11 and above, about reproductive health and fertility? And some of those parents have asked me those questions about mRNA. And how do you unpack that for our parents? And how do you give reassurance to your parents that the mRNA will not have any quote unquote long-term, long-standing side effects on children's fertility?
It's a great question. Misconceptions about the COVID vaccine's effect on fertility are very common, and there's a lot of misinformation out circulating in the public. It's important to know mRNA is a messenger molecule that's used here to kind of create a copy of the spike protein, which the body then makes an immune response to.
Sure.
This spike protein is important for the virus, and if the body can have an immune response to it, it prevents the virus from getting into our cells and infecting us. The mRNA is just a message, and it does not stick around for very long. The body does not like mRNA just floating around willy-nilly, and so it breaks down the message pretty quickly. It makes some copies, but then the vaccine message kind of gets shut off. It does not affect your DNA in any way, and there's absolutely no reason to think that it would affect fertility. There haven't been any reliable reports of effects to fertility, and at this point in time, I feel it's very safe for children, or even for older individuals, adults who are looking to get pregnant or are pregnant. Currently, all the recommendation is for those individuals to get vaccinated, as the effect of COVID on pregnancy is much, much worse and is well known, whereas the vaccine hasn't actually been shown to be detrimental in those cases.
Sure. Thank you. Thank you. And another question is that if my child has had COVID last year or this year, is it still important to get them vaccinated?
It is. And the reason for that is kind of what we've seen. Dr. Surasak earlier mentioned that we are boostering for the vaccine. We know that at some point in time, the immunity wanes from these vaccines and from infection. And getting the vaccine seems to be helpful and protective. At this point in time, I have one other misconception that I want to make sure that I kind of address here is that kids with COVID don't get sick. And that's just not true. At this point in time, I've taken care of well over 100 children in the hospital with COVID. Unfortunately, 3 of my patients have died. COVID can be very severe. I have taken care of a couple kids who've been admitted from the hospital who had prior infection and then 6 to 8 months later got sick again and wound up getting readmitted. I have not taken care of anyone who has been vaccinated and then subsequently hospitalized. And so I feel very strongly that these vaccines, while not perfect, are very good at doing what they are supposed to do, which is keep you out of the hospital with COVID.
Sure. Another comment that we would like to hear from you, Dr. Mickey, is about flu vaccination and COVID vaccination. Can they be given simultaneously or 1 to 2 weeks apart? And is there any cross reactivity? So if I get COVID vaccine, should I still take flu vaccine? Or if I get flu vaccine, should I still take COVID vaccine? How important are these 2 viruses are?
Great question. So flu is important. It has always been important. And the flu vaccine is our best method to prevent you from getting the flu. That was true before the COVID pandemic, and it remains true at this point in time. Flu and COVID are completely separate viruses, and the vaccines do not kind of interact or protect you from each other. So the flu vaccine won't protect you from COVID, nor will the COVID vaccine protect you from flu. Initially, back in December and January of last, kind of late 2020, early 2021, when these vaccines were first approved, the recommendation had been to kind of avoid concomitant use with another vaccine. However, we've since done considerable study, and we see that administering the vaccine at the same time as another vaccine doesn't seem to affect the effectiveness of the vaccine, nor cause worse side effects. So at this point in time, it's recommended to get both of them kind of as soon as you can. And if that means getting both the influenza vaccine and the COVID vaccine on the same day or within the same week, that's fine. You should just get the vaccines, both of them at this point in time, as soon as you can.
When there's new vaccine coming into the market, parents always just want to wait and see. Yeah, but this is a pandemic era. You cannot really wait and see. Otherwise the virus will get you first. Yeah. Another thing is people ask, if I just got the COVID infection, how soon can I get the COVID vaccine? If you look at the CDC recommendation, they said you can get the vaccine as soon as you recover from it, 2 weeks.
Okay.
2 weeks after.
Sure.
However, if you look at the immunity, usually you're going to have the neutralizing antibody, which will protect you for some times. For a healthy host, probably 90 days would be more desirable, more reasonable before they can get the vaccine.
Sure.
Now, then another question people may ask is, why do we need to booster? And the reason is because this virus, the incubation period, which is a time when you encounter the virus to the time that you start having the infection, is quite short, too short for your cells, your immune cells, to remember and also to start producing antibodies to protect you. This is why people can get sick again after 6 to 8 months even after the vaccine, and of course after the infection. So this is the question. The next thing that FDA is going to say is, who's going to get a booster? And my guess is probably everybody will get a booster.
Sure. So before we conclude, Dr. Mickey and Dr. Surasak, what do you think going forward? What do you see a scenario in your crystal ball for next year, next fall, and next winter as to would this become a routine vaccination, just like flu vaccine, that everybody would get 5 year onwards, or maybe even from 6 months to 5 years, just like what we do for flu kits? Dr. Surasak first, and I'll request Dr. Mickey to comment.
If I have a crystal ball, I can tell you exactly. However, just from my guess, looking at the incubation and also the waning immunity, I think this is gonna be probably like an annual vaccine or seasonal, maybe like every 6 to 8 months. That's my guess.
Sure.
This virus is gonna stay with us for a long time. The more we get people vaccinated, the less likely the virus will have the freedom to spread. And as you can see that the more you let people unvaccinated, the virus will have the freedom move around. This is an RNA virus. They mutate very quickly. And as we see, we have Alpha strain from Britain, right? And then we have Delta strain from India. And now we just have some cases of Delta Plus, which may be even worse. So our antibodies may not be able to neutralize the newer strains if we still let the virus going like this in the community. Sure. But once you are fully vaccinated, majority of the world population are vaccinated, I think the chance of the virus mutate will be less and less. Sure. And then I truly think that the only way that the world community can get out of this is by vaccination.
Sure. Dr. Mickey, your comments?
Yes, I agree with everything Dr. Surasak said. I suspect that at some point in time, this may wind up becoming an annual vaccine or something to that effect. Some of that will be mitigated by vaccine availability and the need to, and importance of not vaccinating just the United States, but vaccinating the rest of the world as well. Sure. To go along to expound upon another part with the crystal ball, I do think there are ongoing studies to evaluate both the age ranges 6 months to 2 years and then 2 months to 5 years that are currently underway. They're looking at using an even smaller dose than what's being used in the 5 to 11 range. But those studies are ongoing, and I suspect within the next 12 months, you'll wind up seeing approval at least for the 2 to 5 year range, and probably both for the for the entire 6 months to 5 year range. Right. That's my speculation based on talking to friends I have in the industry and kind of where things seem to be going right now.
Sure, thank you.
I also agree. Apparently, remember one thing in the phase 3 study, which is the phase before they get the EUA emergency authorization. The study was done in only a couple thousand people.
Sure.
And I think they also have a similar population in the 2 years and older, and also 6 months and older.
Sure.
According to Pfizer BioNTech, they claim that they are looking for getting an approval at the end of this year. Let's see whether it's true or not.
Sure. Dr. Mickey, question on everybody's mind. How important are masks, hand washing, and physical distancing still? And when do you likely think, and this is a question on my mind as well, about getting rid of the mask so we can see everybody smiling again? Any last comments, Dr. Mickey?
These are great questions. So having taken over the role of head of pediatric infection prevention at Advocate Children's recently, I can tell you that these are the questions on everyone's mind. Vaccination is the only way to get rid of the masks and close contact at some point in time. We have to drive the circulation of this virus down to a safe point.
Sure.
At this point in time, we're not there. And so you're still seeing you're still seeing masking required in places like hospitals and most restaurants in Illinois, those sort of things. The hope is that if vaccination becomes very widespread, that will go away and we can kind of see each other smiling, not just through a computer screen like we are now, but in person in a comfortable fashion. The hand hygiene importance never goes away. Hand hygiene is always important. There will always be viruses, be it SARS-CoV-2 or the simple cold virus, that you should wash your hands. And that's a recommendation that I can make confidently that will last for the rest of time.
Thank you. Thank you to both Dr. Mickey and Dr. Surasak for your valuable time. We learned a lot today. I appreciate your time and have a great holiday season. Thank you very much to both of you.